My name is Carrie Kelley, and we will be doing an assessment on Mr. Kelly today with his eyes, ears, nose, mouth, and pharynx, then his lungs and his cardiovascular. Um, so first, Mr. Kelly, let's get started with your eyes. The first thing we'll do is test the cranial nerve number 2, which is the optic nerve, and with that we can test the visual acuity. So we've already done that with the signal test, Snellen test, which would be 20 feet on the wall, which tests distance. And because he does not wear glasses or any corrected vision, we tested it uncorrected, without any correction. And then next we have the Rosenbaum test, which is the nearsighted test, and it's reading, which would be 14 feet on a card in front of him. Tested uncorrected, and if he had glasses, we would test it corrected. So next we're gonna test the ocular movement, which will be cranial nerve number 3, 4, and 6, which is the ocular motor, the trochlear, and the abducens. And so if you will follow my lights, and we'll test it with the 6 cardinal gazes, and just follow it all the way up. Good job. All right, next I'm going to shine a light and just stare straight at it. All right, a twinkle is noted symmetrically in both sides to test the corneal light reflex. And next we'll do the cover and uncover test. So if you will just cover up your left eye and look this way in the left, look towards the right, I'm sorry. All right, without moving your eyes, take this hand down. All right, both eyes are noted to shift to the right, which is normal. Next, we will move on to just inspecting his eyes and his eyebrows. The hair is well distributed. There's no absence of hair noted. It goes and encompasses to the outer of the eyes. His eyelashes are well distributed. The hair is well distributed all throughout. There's no flakes or dandruff or anything noted. Next, we'll look into his eyes, the conjunctiva. There's slight pink in vessels noted. The sclera is white. The irises are blue. The pupils, we'll go ahead and do some eye test on you. And just look straight at my nose. The pupils are round and reactive to light and to the accommodation, and they are consensual. They are equal as well. Next, we'll look in the inner eye, which also tests the cranial nerve number 2, which is optic nerve. We would do this with the lights dim. All right, what I need you to do is look straight ahead, and I'm going to test just look into your right eye with my right eye. I see the red reflex. And I see the fundus, which is creamy yellow. The optic disc is noted, and it is round and 1.5 centimeters in diameter. The macula is noted, which is gray and avascular. There's also arterial and venal noted, which is 2 to 5, the 3 or 2 to 3 ratio. In the macula, there is the fovea centralis, which is the center of vision. So next we're going to move on to the ear, but before we do that, I'll scan the room. All right. Okay. Make sure we got it back. Okay. All right, next we're going to move on to the ear. Let's switch this real quick. All right. First, we'll inspect both ears, the arcula and the mastoid area, and the top of the ears are symmetrical with the eyes and even with the outer of the eye, and they retract back well. Is this tender or at all?
No.
Okay. so it's not tender or swollen in the mastoid area. We're going to look in his right ear first, and we'll slowly look in, and we'll note as we go into the external meatus and the inner ear, there's hair noted in, and I see the tympanic membrane, which is pearly gray. There's no bulging. The umba is present, the malleus is present. There is the paris tennis, which is below, and the paris flaccid, which is above. That is noted, and we'll look in the left ear to make sure there's the same. All right, the same thing is noted. The tympanic membrane is pearly gray and non-bulging. With the ear, we're going to test the cranial nerve number 8, which is the acoustic. So first, I need you to plug up this ear, and I'm going to whisper something to you, and I need you to repeat it to me, okay?
Okay. It is hot outside.
Okay, thank you. You can put that arm down. All right, next I'm going to check your hearing for the right or left. What I'm going to do is put this on top of your head, and you let me know if you hear it in the right, left, or in both.
Both.
Okay. Next we'll check, and that was the Weber test. Next we'll test the Ryan's test. I'm going to place this behind your ear. You tell me when you quit hearing it, okay?
Now.
All right. Tell me when you stop hearing this. Do you hear it?
Mm-hmm.
All right. Tell me when you stop.
No.
Okay. That tests the air conduction and the bone conduction, and it is a 2-to-1 ratio, with the air conduction being 2 and the bone conduction being 1. All right, we will move along to your nose. It is midline to his face and symmetrical. The color is with the rest of the skin. There's few sunspots noted. Also, can you lift your chin up for me? The septum is midline and it's symmetrical. Look in your inspect your nose real quick. All right. It is, the nostrils are even. If you can, we're gonna check the patency. So if you could hold one side and take a deep breath. All right, and let's do the other side. All right, we're going to check your olfactory cranial nerve number 1. If you can smell this, close your eyes and one nostril, close one nostril and smell. Can you tell me what that is?
Vinegar.
Okay. Let's do the other. Let's try the other side and close your eyes, which you don't really have to close your eyes to. All right, can you tell me what that is?
These.
Okay, great. Next, we're going to move along to his mouth and his pharynx. First, we'll notice that his lips are symmetrical with his face. They are pink and moist and non-chapped. If you will smile for me. His teeth are white and clean. Open your mouth for me. All right, we will count them. All right, he has 28 teeth and 4 fillings. No dental caries noted. Can you say "ah" for me? Say "ah." All right, tonsils are 2+ in size. The uvula is midline. I'm gonna touch your mouth. Gums are pink and no ulceration noted. Say "ah" one more time. The buccal mucosa is pink and moist with no ulcerations noted at all. Lift your tongue up for me. All right. Okay, you can close it. With the mouth, we're going to test cranial nerves number 9 and 10, which are 10 is the vagus, and then the hypoglossopharyngeal. And with that, we check the midline of the uvula and the hard and soft palate, the rising and falling of the hard and soft of the soft palate. we also would check that with swallowing and speaking and the gag reflex. And then we would check cranial nerve number 12, which is the hypoglossal cranial nerve. If you will stick out your tongue for me and move it to side. Okay. And stick it back up for me. Okay. And that's what cranial nerve number 12 tests, is the movement of the tongue. All right, so let's go ahead and move to your thoracic and the cardiovascular part. I will need you to take your shirt off for me. While he's doing that, I'm going to scan the room. All right, Mr. Kelley, first we're going to look at the anterior chest, and there is no bulges or masses or tender. Is there any tenderness when I touch at all? Any tenderness noted. I'm going to look at your back too, and there's no bulges or masses or tenderness. Okay, noted. So if you don't mind, I'm going to get you to turn around. All right, first thing we're going to check is the expansion of the lungs. So if you can take a deep breath for me. All right, when he takes a deep breath at the T10 space, my fingers do come out and he has great expansion. Next, we're gonna test the diaphragmatic excursion. So I just need you to take a deep breath and I need you to hold it. All right, you can let it out. Let's do that again. Take a deep breath and hold it. All right, you can let that out. All right, next I'm gonna do it again, and I need you to take a deep breath and then hold it when you let it out. All right, hold that for me. All right, that's great. I'm gonna measure that real quick. Your diaphragmatic excursion should be 3 to 5 centimeters, and his is exactly 4 centimeters. All right, next we're gonna percuss your posterior lungs with a pleximotor form, and we're checking for any dullness. Okay, that's great. All right, next we are going to auscultate your lung sounds, and every time that you place the stethoscope on each field, we would ask him to take a deep breath in, but I'm not going to ask him to take in as many deep breaths. All right, you can turn back around and we'll auscultate the front, the anterior thoracic. Okay, you don't have to say that to me. All right. Next, we're going to move on to the cardiovascular area, and so first we would just inspect and make sure there's no masses or anything that would be going on right here. I don't see any pulsations or anything like that. I would place my hand on the point of maximal impulse right here, and there is no pulsation and no murmurs noted upon palpitation. Next, we're going to auscultate the different sounds of the heart, so I'm going to place my stethoscope just around. First, we'll go to the mid-clavicular line and go to the 5th intercostal space. And here we are listening to the mitral valve, or the mitral area, and we'll note that S2 is greater than S1. And then we'll go to the 4th left intercostal space. and we're listening to the tricuspid valve. And we'll note that S2 is greater in sound. Next, we'll go to the third intercostal space, which is this Erb's point. And S1 and S2 sound are equal. And then we'll move to the second intercostal space, left intercostal space. And this is the pulmonic area. And this is where we hear S1 is greater than S2. And then we'll go to the aortic area in the right intercostal space, second intercostal space. And S1 is greater than S2 as well. In all areas of sound, there's no sound. I do not hear S3 or S4 or any murmurs. Next, lastly, we will palpate the pulses, which is the temporal pulse, the brachial pulse, the radial pulse. All right, and then we'll go to the popliteal pulse, which is behind the knee, the posterior tibial pulse, and the dorsal pedal pulse, which is on top of the foot. And all pulses are 2+, which is normal. Thank you so much.